Now we see the cystitis, that is infection of bladder with the lower urinary tract. So how can you differentiate between the pyelo and the cystitis? As cystitis infection of bladder with the lower urinary tract and the pyelo is infection of the upper urinary tract. So upper urinary tract is pyelo while lower urinary tract is cystitis. This is one of the difference between you can find, and we all know the medicos, this is a common basic difference. And what we can see that in this, the causes between them, both of them, that is a bacterial infection. And one of the reason that you can find also question that they can ask about the root. What is the root of the transfer of this from cystitis to pyelonephritis? So this could be the most one of the common reason for this ascending route, because of the passing through like blood with the help of blood. And then we can go for the clinical picture of cystitis. So the clinical feature of cystitis is like dysuria, the pain with urination, like especially at the end. So you can also be can be seen in the question that they can go for the question that a 48-year female old having pain at the urination or infrequent urination, and they will ask you, and you can specifically see in that pain at the end of urination. So this can also be seen, and you can from that also you can find that the answer, this is cystitis. This is the feature that you can difference between them. And the pain will be that the suprapubic pain you can see. And the urgency of the feels, like the patient will say that always feel like to go now, like for the urination. So, and then we can see that what we can see in the lab diagnosis of this cystitis. So in the lab diagnosis, we can see the fresh erythrocytes. So we can see in the fresh erythrocytes. And the treatment, if we talk about the what is a common treatment between them. So we have the treatment in between them common. For this is for cystitis and this is for pyelo. So we can see that for cystitis that treatment will be sulfonamide, trimethoprim, methoprim. And if the patient is in pregnancy, so as we know that pregnancy, the safe drug will be nitrofurantoin. This is the safest drug. And in the pyelo is a fluoroquinolone and ciprofloxacin. This is a drug you can find. And this all about this, the pyelo and cystitis. Later on we'll all talk about another topic. So goodbye.